Trauma. It's a word with a very deep meaning, but it often gets misunderstood, misrepresented, and overused these days. People experience different types of trauma for different reasons. This could be due to our childhood, our past experiences, significant life events and circumstances. But were you aware of the fact that there is actually a type of trauma called medical trauma? And that again is quite a loaded concept. So in this video, we're going to explore what medical trauma is and what are the reasons for it, and look at some examples of it as well. Welcome back to my channel, everybody. Thank you very much for joining me every single week to be a part of this platform, this community, and get the tools, tips, and strategies that I provide for you on this channel. My name is Shweta. I'm the founder of Healthy Dynamics. We are a coaching practice that helps English as a second language healthcare providers who work closely with patients on a daily basis become better, more empathetic, collaborative, and impactful communicators to build better relationships with their patients in order for them to get better testimonials, recommendations, referrals, and progress further in their career. So if you are a healthcare professional who works in an international hospital where the patients and the staff members predominantly speak English, and that could be either in an English-speaking country or in a non-English speaking country, you as a healthcare professional speak English at an intermediate level, but it's not your first language. At the same time, you could also be someone who lives in an English-speaking country or is looking to relocate to an English-speaking country and just wants to become a better communicator and understand the nuances of communication to work better with patients and build better relationships with them. You have absolutely come to the right place. So like I mentioned at the very beginning of the video, we're going to look at the concept of medical trauma in this week's video. And the reason why I had felt that this had to be brought to my attention is because I've been hearing a lot of horror stories, unfortunately, of a lot of the things that are happening in the US predominantly, specifically in the space of reproductive health. But I'm sure that medical trauma is not just because of women's reproductive health, it's for several other reasons. I will link some of the stories over here or to this post that I have just recently heard. And also this ties very well with medical gaslighting. I have an entire channel of a playlist over on my channel on that, which I can link towards the end of the video. And I also recently also heard a podcast that I've subscribed to and I follow every single week. I listen to it, and the episode last week was about medical gaslighting. That deserves a different video in and of itself, but let's just talk about what medical trauma actually is. So medical trauma isn't just the dread that people normally experience when it comes to going and seeing a healthcare professional for an appointment. And I'm one of those people. You know, for me, the thought of going to a healthcare facility, the thought of again sitting in a queue, and especially when I'm not sure about, you know, what's happening with my health, and that anticipation as somebody who already has anxiety and is not the most patient person when it comes to waiting in any sort of facility, for me it's a dread. But I wouldn't say I'm traumatized by it. So there are two very, very different things. So it's a much more deep-rooted and a much more nuanced concept, medical trauma. So if I have to put a very simple definition for you, it's not just about the physical body. That's the other thing. It mainly is to do with how the patient's experience has been in the healthcare system, which impacts how they feel emotionally in terms of safety and trust towards healthcare facilities and professionals. So a very simple definition of medical trauma is the psychological and emotional response that results from negative or harmful / traumatic healthcare experiences, especially those that involve fear, helplessness, loss of autonomy, and sometimes a significant breach of trust. Now, this can happen as a one-time event. It can happen over a stream of very similar negative experiences. It can also happen because of the anticipation of harm in certain medical situations. So it is very similar to PTSD. Now, PTSD is a completely different concept in and of itself, and there is correlation between PTSD and medical trauma, but they're not, again, one and the same thing. So I just wanted to put this point across just to clarify what medical trauma is and isn't. So medical trauma is PTSD, but in a very, very specific context and a very specific scenario. So you are in a healthcare facility and your trauma is in relation to anything that has happened in a healthcare facility, And it could be not just because of you, it could be happening because of one of your family members may have experienced something you found quite traumatic, and the healthcare professionals did not deal with it properly. So one example that I'm going to leave, this male nurse mainly violated some of his female nurses their boundaries and their expectations and just their requirements. Similarly, another TikTok that I have come across, where the patient specifically mentioned that they do not want a student nurse or a student healthcare professional attending to them, and the healthcare professional went and did just that. Or they said that they went into a hospital assuming that it's only with people and healthcare professionals who are experienced, who've been doing this for a very long time, but only for them to turn out that they've been given completely false information. And that breach of trust is what has led to medical trauma. And these are just some of the different examples. So let's now look at some other very common examples that can happen in medical trauma, specifically also with some of them that relate to healthcare professionals who are from English as a second language background. Now, one of the most common sources of medical trauma, and I have experienced this myself personally and also heard of countless stories of this, mainly from the US, but I'm sure this happens in other parts of the world as well. And this is very specific to female reproductive health and anything to do with their health in general, women's health, but mainly specifically their reproductive health. So the main reason being their pain was overlooked, pain or symptoms were overlooked, dismissed, and ignored. Now, say for example, a lot of my friends are going through endometriosis, or they have been diagnosed endometriosis very recently. But what has happened is that they have shown symptoms of endometriosis 20, 30 years in the making. But what has happened is their pain was, and when they went to a healthcare professional, so they're an OBGYN or just a GP or anything like that, they have just been dismissed from time to time that this is just part of them either getting puberty, either reaching their 20s, their 30s, and tying that into other health problems that they may have. So again, they refuse to do, the healthcare professionals refuse to conduct any relevant tests that needed for them to get the correct diagnosis that they have endometriosis. And now, 20, 30 years later, they are facing the consequences of it. So they are going through endometriosis, they are undergoing a lot of extensive tests and a lot of invasive surgery and treatment options for them to get to a better place. And this happens also all the time when it comes to, again, women who are pregnant and who are undergoing even menopause, very common reasons. But yeah, I personally have seen, heard, and experienced this a lot in the space of women's reproductive health, but I'm sure that it happens pretty much anywhere. But I think the healthcare professionals are very, very good at making women the victims in situations like this. This is not throwing anybody under the bus. This is just from my experience and what I have heard, being as someone who follows quite a lot of these sort of pages on social media. This is what I've come across from time to time. So the bottom line is that when patients feel ignored and validated, their needs specifically. Secondly, an example of medical trauma that patients can experience is when there is language barriers and fear. So what can happen is that sometimes in certain cultures, I know for a fact that in cultures such as Japan and Korea, where mainly Japan, where say people who are overweight for whatever reason, it's not just because they are living an unhealthy lifestyle. It could be for people have hormonal problems. People could have anything, some sort of a condition. They could be some sort of medication that makes them gain weight. They could have autoimmune diseases. But say for example, this is more of a cultural barrier. So say for example, if you are a patient who was of a Caucasian background, and you may have one of these conditions, and you go to a doctor who is Japanese and you're living in Japan, and it could be an endocrinologist, and you're saying to them that I'd like to get some help and support in making sure that I'm having this problem or whatever it is, and A very common thing that a lot of healthcare professionals, not just in this case the Japanese people who are doing this, I'm just using that as an example, the very first thing they will say is that, have you checked your weight? And in a country like Japan, it's very easy. Japanese people are very polite, so they will not tell it directly to your face, but they will make you feel like if there's something significantly wrong with you or you've made poor choices just because you are overweight. And then again, just to put this in a different context, in a different example, you can have a situation where somebody could be, a female patient could be experiencing any kind of symptom or any kind of condition, and the very first thing that a healthcare professional will say is, what's your weight, and have you tried losing weight, even though the symptom may have absolutely nothing to do with their weight whatsoever. So that again is a big source of trauma. A huge one also is misdiagnosis. So say for example, I have personally heard of a lot of stories was constantly her symptoms were misdiagnosed or just not looked into, and only for her to realize that she's been living with stage 4 colon cancer or whatever the disease is. So again, this again is very common when it comes to mental health conditions. When you are giving patients a diagnosis, you are, what I'm seeing nowadays is that people get diagnosed for anxiety, depression, OCD, whatever, because back in the day, we didn't know what ADHD or autism was. Now, that's much more accurate. So a lot of the symptoms that people are showing nowadays is actually for ADHD and not necessarily for anxiety or OCD or BPD or whatever the case may be. So in this situation, a patient can really feel betrayed or let down by the medical system. Now, let's look into some of the reasons why medical trauma actually happens, what the root causes are. But they may or may not be intentional, just letting you know, but they absolutely leave an emotional imprint, and it really can scar a patient for life, and it can really make them lose trust in the healthcare system. Dismissive or rushed communication. Patients feel invisible when professionals don't make eye contact, interrupt them, rush through explanations, and also keep, dismissing them and also invalidating their concerns. This is something that I personally experienced a lot of the time. I've often spoken about my psychiatrist who was very good at doing this. When I would say to him every time that I do not want to go back to the past, I want to deal with my current challenges, he would just dismiss that and just say, I want to go back to the past to look at the patterns, even though that has already been established. I'm like, I know my patterns, let's just get past that, because going to the past is giving me it's triggering me and it's giving me anxiety. This form of, this lack of communication, this poor form of communication is what led me to cut him off altogether, and I completely lost trust in psychiatrists after that. Now I'm with a therapist and I'm very happy with her. But then again, this is why a lot of people do not trust healthcare professionals. Again, I've made a video about this on my channel, why patients don't trust healthcare professionals anymore, which you are welcome to check out. Second one is lack of informed consent. When patients aren't clearly told what is being done and why, it creates fear and distrust. This is very closely linked with patient autonomy and also transparency in communication. So when a patient is given information about anything, whether it's surgery, whether it's some form of treatment, medication, whatever the case may be, you have to tell the patient everything about what they can expect and what they can experience. I made a video again on my channel sometime this year when I spoke about my surgery experience of my left clavicle and how amazing that went. And one of the reasons for that was because the healthcare professionals who were looking after me were extremely transparent about what I can expect during, before, and after the surgery, what I can expect as a result of the side effects of the medication I'll be on, painkillers specifically, what I can expect in terms of how the recovery process will take place, what I need to do, and what I should avoid. They laid it all out for me, not just verbally, but also in a crystal clear fashion. And also they sort of walked me through illustratively, animatedly, and in a written format what I can expect during and before and after the surgery. Only when I read through all of that did I sign on that dotted line saying that, yes, please take me into the operating room. When you do not do that, that is a breach of informed consent, and that creates fear and distrust amongst patients. Cultural or language barriers. Now, this is a huge one, and I'm not just talking about people not being able to understand speaking the same language, because in every language there's also a concept of nuance and there is cultural competency as well. So when healthcare providers don't understand patients' cultural norms or struggles with language clarity, it can lead to miscommunication and fear. So say, for example, you are working with a Muslim patient, a Muslim female specifically, and again, when the patient specifies that they do not want a female, do not want a male healthcare professional, say they're doing a sonogram of some sort and they want the sonographer to be female, and you go out and get them someone who's, say, non-binary or someone who's trans. Now, I'm not saying that there's anything wrong with that, but a Muslim person may not understand what being non-binary and what being a transgender person is. So again, when that disconnect is there, again, that is going to create a friction, and that's going to create a barrier, and that's going to lead to a breakdown of trust and communication. Power imbalance. When patients feel that they have no say or are talked down to, they shut down immediately. And when they have to, again, they're at the mercy of healthcare professionals, where they are looking for answers, they're looking for solutions, but every time one time they have a bad experience, that's what will stay with them, and every time they will go into a healthcare facility, that is how they're going to perceive it, that this person is not there to help me or support me, that this healthcare professional is here to just put me down and invalidate me and just tell me what to do, and basically impose their judgment and opinion on me just because they are a person of authority. If that is what their preconceived notion is, I wouldn't even call it a bias, a preconceived notion, because of bad past experiences that I've had, that is 100% a source of medical trauma. And finally, being judged, causing judgment, having biases. Patients who are overweight, smokers, or live with addiction, they can often experience very subtle or very direct judgment from their healthcare providers, even though A, they're not supposed to do it, and B, that's why they are seeking healthcare professionals' support and help, because they need to get themselves to a better state of health. And what you should not be doing as a healthcare professional is subtly or indirectly or otherwise throwing jabs at their condition, because they have got to this point, whatever the reason may be. They may have chosen to become an addict, and I'm not going to go into addiction not being a disease, that's just my personal opinion, but still, even if the patient has made poor choices to smoke, to use drugs, or abuse their body through junk food, again, it does not warrant a healthcare professional being judgmental and dismissive towards them. You have to be there to support them. Hold them accountable by all means, but it's not your place to throw them under the bus every single time when they're coming to this problem with you. So I'm going to look into the concept of, I've just realized this video is going on for quite a long time, so I'm going to look into the concept of how to overcome the concept of medical trauma, and over the next few months I'm going to do quite a lot of videos on the concept of trauma and how healthcare professionals, not just the ones who work in trauma with trauma-related patients, but also everyone else, can get a better understanding of it. So because it's something that doesn't get talked about, unfortunately, that often. So stay tuned for that, and for the rest of this videos on this channel, make sure that you hit the subscribe button, the notification bell, leave this video a like, comment your thoughts and feedback down below in the comment section. And as always, thank you very much for your time, attention and presence, and I shall see you next week.